practices will benefit because of it's an increased revenue stream. Typically, if I think it's a good reputation builder as well. I think as a dental practice on the high street, if you've got a dental hygienist showing us working there, it shows that you're committed to prevention, shows that you're committed to preventive care, and I think also that holistic care for patients as well. You're not just about active operative treatment, that you're about helping that patient to take care of themselves, to be empowered. It's more sustainable, it's better for the environment because there'd be fewer trips coming into the dental practice. So I think from a reputation side of things, it is good. And then also, as I say, the reputation builder and another income stream of patients coming in to see that individual, who otherwise may not have come into your practice.
If you do refer patients upwards and they then become a patient of the practice and uptake perhaps on some more complicated treatment, then there's an increase in income from that point of view.
It removes that administrative burden from the practice, double appointments. It means that the dentist doesn't have the administrative work of treatment planning, writing prescriptions, etc.
It's a much more efficient use of everyone's skills and provides a better level of care. For practices that have CDTs in them, it helps with patient flow. The patients can see a CDT directly. It means there's reduced waiting times for them rather than seeing a dentist. And it does mean, of course, that the dentists in the practice can get on with the tasks that they may enjoy more than providing dentures and more complex and technically demanding treatments.
So benefits for practices implementing direct access are things such as improved patient flow and efficiency. This also frees up the dentist's time to carry out treatments within their scope of practice that we're unable to carry out. But ultimately, it helps expand the practice services as well as appeal and make sure that the whole team are being fully utilised.
In terms of the practice, that means that it's a much smoother workflow, that there's a less chance of patients not turning up for appointments, less chance of cancellations because there's only one appointment being booked. So less reception work, less administration, less paperwork all around.
So for practices, I think the big benefit is the ability to be able to delegate work to certain team members that enjoy hopefully that particular aspect of what they do. So I think, looking at each of the areas, for example, you could, I always make the argument that, that if you get into a niche area that you really enjoy, so for the general dental practitioner, for example, you could end up doing the simple treatments almost the majority of the time. And it is said that 65-70% of the claims put through the NHS is actually able to be carried out by dental therapists. So on the one hand, you could be able to utilize full team members. I think when people who have the ability to work to the top of their scope, they're more likely, I think, to feel more fulfilled. That doesn't apply to everyone. There will be some that very much happy with exactly what they're doing, but there'll be a significant portion that really want to work to the top of their scope. And I think anything we can do to help them do that is likely to retain a member of staff in that particular environment that is really good.
And I think the impact has been definitely very positive in relation to respect and cohesive working and team building, because there would be a lot more that hygienists or therapists would be able to recognise and to refer, so it builds that rapport.
Dentistry, I always say, dentistry is team sport. You have the ability to be able to provide care at various different stages. And if you look at any other sector in terms of, any other business, even other parts of healthcare, you have a situation where you tend to be able to find a way of working that is quite, that makes the running of a practice, for example, really quite efficient. Whereas in dentistry, we still seem somewhat really reliant on trying to keep usually the dentist being the most sort of expensive person in the whole pathway, actually you're trying to make them do sort of 95% of all the patient-facing parts that they do. Whereas you've got the ability to be more efficient, have team members that can work closer together. And that's not necessarily direct access. That can just be delegated care. But I think, to have direct access to be able to open care, we've got situations in Europe where, I know of one country where 98% of all 12-year-olds had already seen an oral healthcare professional, but it's through an enhanced hygienist, and if that seems to work, whereas the expansion of access, I think, is key. There's also an element when you take into a clinical dental technician. I've been talking about this for a little bit, where when you've got a situation where the dental school that trains up dentists are having to find cases for those students, and those students are effectively at trying to find, let's say, partial denture or full denture cases, that actually a dental student can get through dental school without having done very many of these. And some of them will still enjoy it, but some of them won't. And that it's almost, they'll almost get into a situation where when they go into foundation, because there are less dentures out there actually overall, that they end up finding a particular part of dentistry that they may not actually entirely enjoy. And then you've got, a group of a registered group, our smallest registered group actually on the GDC register, the clinical dental technician, that can very easily fit in and slot in, and it's work that they enjoy. And I do wonder, as things progress in years and decades on, whether we would be really wanting removal prosthesis to come from a workforce that's really happily doing that. And the other thing, it does free up. And I talk to dentists all the time, and some of them really want to progress. You can't progress to do even more sort of specialized things if you are spending 90% of your time doing things that are quite simple because you're keeping your patient base. So it's sort of multifaceted, really, in terms of how good it is for the dental team. I just think, it's the ability for us to enact, to let people carry, the workload across a whole team, which is ideal.
It's been very positively received by the team and obviously patients. The pressure on the dentist was fairly immense over the last few years. And there was an increasing problem prior to the pandemic to access dentists anyway. A shortage of dentists available, and so with an increased team workforce, it just made it better for patients to actually get in. Most of the team members have seen it as innovative, exciting, and there seems to be a lot of job satisfaction as more duties have come their way, more responsibilities have come their way, and they feel empowered to be able to do more.
I think there is a misconception sometimes within the profession that, direct access is a little bit of a threat maybe to dentists, that, it can be taken away from what they can do. But I've actually found in my practice the complete opposite to that. I have had countless patients that have come to me for direct access, maybe for periodontal work, restorative work, that I've then referred on to the dentist in my practice to have more extensive work that's not within my scope of practice. So, things from ortho, implants, porcelain smile designs, all these kind of things. I think the whole practice, the whole team really benefits when we all embrace direct access, because it's only, good for patients because they can be more easily seen and they're getting the treatment that they need. It also means that it's bringing more patients into the practice in the first place, and they can access any team then.
And also for the dentists, it frees up quite a lot of their time on, the sort of people that they come every 6 months and all they ever need is a hygiene visit. Their caries free, they've got no periodontal disease, they never need anything more. So it means the dentist doesn't actually have to see them as often. So it does free up time. So if it's done properly, it's mutually beneficial.
For me, it has made not a lot of difference because, I still worked within my remit. I still made my own treatment plans. I would have discussed them like I still did afterwards with the guy I worked with. It was the last place I worked was restorative specialist practice. So we would have discussed our patients and where we were going with them in order to understand the needs for both. So that didn't greatly change. As it was in a practice, I did the same as I always did. The barrier was away. I didn't have to worry about the patient coming to see me first or seeing the other clinicians in the place before me. It was just easier.
It just brings more skill mix into the practice. It really just gives more accessibility again for us to be able to provide additional care that the patient may need.
When I started my business, it was founded off the back of direct access, and I've been able to enjoy building a brand across multiple sites in London offering direct services, and I've seen directly the impact that has for patients, but also for the rest of the practice and the clinicians working there.
The CDTs that operate their own clinics, I think they play a vital role in the local dental community as well. They're a point of referral for dentists. It means that patients who have complex removable prosthodontic needs can be seen by a CDT. They hopefully receive the best possible care, and it's a good model that supports collaborative patient management and gives good patient outcomes, and that's what we all want to see.
Of patients who have access to dental care, but they perhaps know that they would benefit from seeing a hygienist, or perhaps they've moved area or something, moved practice, and they'll actively seek one out. Then they can still see their dentist at the regular practice where they're happy, but it then also does give them the opportunity, the flexibility, if you like, to see the right clinician to do, to offer the right care that they need. So I think it's a win-win for practices, for patients, and for the clinicians, I think.